mentorship program, 5-day, where a mentee like myself spends 5 days in an area of my choosing.
Yes, to try and mentor them and provide an experienced nurse that maybe has been working in mental health for a while, that may be working in a similar area to theirs, or it may be an area of interest that they might want to get into.
I wanted to work with developing and fostering my leadership skills.
My choosing was forensic mental health, and NSWNMA acted as my mentor.
I chose to focus more on the acuity of patients.
Eddie came from the Illawarra Mental Health Service. He actually works on the acute care team down there, and they were looking at implementing some changes about the way that their acute care team functions.
I was mentored with Rui Rodriguez at Wagga, the next team down there.
Neil was really good. He put in so much time and effort into showing me anything and everything that he could squish in that 5 days.
I had a fantastic experience with NSWNMA at Bunya Unit, Macquarie Hospital. He was a fantastic mentor. He was extremely patient, very knowledgeable, very professional.
Really varied. They put a lot of effort into making sure that I saw all of the facets of their service.
He was interested in that service-wide sort of approach, and more around service development and QI projects and service change.
I basically got to see how they ran the ward, what the management plans they did, and the treatment plans.
It was a good experience for him to come in and see how the rehabilitation part of the forensic system works, because there are some technical issues, some legalities attached, some risk assessment which are specialised for forensic patients.
As I met up with their staff in the emergency department, I saw a lot of the facilities they have down there. I spent some time with the executive. I spent a lot of time doing some management things with Rui.
The main thing that stood out was the way that the nursing staff and allied health staff spoke to the clients, the ways that they were engaging.
There was quite a difference between the way their team functions and the way our team functions. They have a lot more clients on their board than what we do. They also have them on for a lot longer than what we do.
So I was surprised by how differently they have to run things down there. They're much more rural than we are, obviously. So the way that they have to overcome some of those rural barriers.
The forensic model of care that they've implemented in Bunya Unit, an invaluable model for us to adopt at Macquarie Hospital.
They just tried to make it as pleasant as possible for the clients that were in there, and then that's something that I have brought back to the ward that I'm currently in.
Rui has a particular management style that's different to the sort of managers that I'm used to. He's very team focused, and I'm here to make the team work. That's my function, which was not a way I'd ever really thought about management before. I could definitely take that back into my own leadership style.
I get a lot out of it, and it's been quite rewarding in terms of building that relationship with them, because they are really keen and they do want to learn.
It's definitely worth it, and a great advantage to have, and to see how another unit works outside the health service that you're already working in.
It was a good opportunity to see how people work in mental health in a general emergency department in conjunction with their mental health unit.
That it's a two-way learning stream. Not only he came and he took everything away from us, he brought a lot of energy to us as well, and he's provided a lot of enthusiasm in the unit.
It has motivated me more to provide more care and be more active and more engaging with the clients that come onto the ward.
It's good to be able to pass on some knowledge and pass on some skills and share why we do it.
Don't think you don't know enough, because even as a mentee you have something to share, you have input to give.
The day I went back to work, I had already said to the nurse educator, we need to nominate more people for this program.
It's a great experience. Such a fantastic opportunity for nurses.